When you hear the words E. coli, I bet your mind jumps straight to those scary headlines about food poisoning, right? But what if I told you that you actually have E. coli in your gut at this very moment, and that's completely normal? Yeah, the story of this bacteria is way more complex and honestly pretty fascinating.
So that really is the big question, isn't it? Is this thing a friend or a foe? Well, the answer is kinda both. It really does have two very different faces, and knowing the difference is absolutely key to understanding our health.
And here's the breakdown. On one hand, you've got your normal, everyday E. coli. It's just a standard resident of a healthy gut. No big deal. But on the other hand, you've got these specific strains that have basically picked up some nasty genetic superpowers, turning them into pathogens that can make us really sick. It all just depends on which version you run into.
Okay, so let's start with the most common side of E. coli. We're talking about the infections that are super frequent, but usually a lot less severe. This is where most people will actually cross paths with a harmful strain.
You know, for all the talk about food poisoning, you might be surprised to learn what the single most common E. coli infection is. It's a urinary tract infection. In fact, it's the #1 cause of bladder infections in women.
But it doesn't stop there, not even close. This bacteria is incredibly versatile. Of course, it can cause traveler's diarrhea, we'll get to that in a sec, but also some really serious problems like pneumonia, meningitis in newborns, and even bloodstream infections if it manages to escape the intestine.
Traveler's diarrhea. I think a lot of us have an unfortunate story about this one. It's typically caused by an E. coli strain that produces a toxin, and that toxin is what causes all that familiar cramping and watery diarrhea. The good news, though, is that it's usually pretty mild and goes away on its own in 3 to 5 days. And now we've got to shift gears. We need to talk about the other face of E. coli, the one that is, without a doubt, a vicious villain.
And this is the whole point. While most of the harmful strains cause illnesses we can manage, there is one in particular that is a completely different beast, E. coli 0157H7. This is the one that makes the headlines.
So where does this dangerous strain even come from? Well, the sources are surprisingly common. Undercooked ground beef is the classic culprit, but so is unpasteurized milk. You can get it from contaminated water in pools or on produce. You can even get it from touching infected animals at a petting zoo if you don't wash your hands right after. And yeah, it can even spread from person to person if hygiene is poor.
When an O157H7 infection hits, it hits alarmingly fast. It kicks off with these severe abdominal cramps, which then quickly progress to watery diarrhea. And then often, in just 24 hours, that diarrhea becomes bloody. It's that speed and severity that make it so dangerous. And this is the most feared complication of all. Hemolytic uremic syndrome, or HUS. I know it's a mouthful, but the name basically tells you what it does. Hemolytic means red blood cells are getting destroyed, and uremic refers to the fact that the kidneys are failing. It is incredibly serious. Now, HUS doesn't affect everyone equally. The people at the absolute highest risk are the very young, so children under 5, and older adults over the age of 60. For these vulnerable groups, this infection can be truly life-threatening. So, with an infection this dangerous, you'd think the treatment would be pretty clear-cut, right? Well, this leads us to one of the most surprising twists in the entire E. coli story. Here's the paradox. For just about any other bacterial infection, including other types of E. coli like UTIs, antibiotics are the go-to solution. They work. But for the dangerous O157H7 strain, doctors specifically do not use them. So why in the world would that be? This quote from the MSD manual explains it perfectly. It turns out that giving antibiotics to someone with this specific infection can actually make things worse. It might cause the bacteria to release a whole flood of toxins all at once, which in turn increases the risk of developing that life-threatening kidney failure, HUS. It's a true medical catch-22. Okay, now that we understand the threat and just how tricky it is to treat, let's talk about the most powerful tool we have, prevention. This is how you can actually protect yourself and your family. The good news here is that the steps are pretty simple. Number 1, cook your meat all the way through. Number 2, wash your hands often and well. 3, stay away from unpasteurized milk. 4, try not to swallow water when you go swimming. And 5, for preventing those common UTIs, it's all about hygiene.
So if there's one thing to remember from all of this, it's that E. coli isn't a simple villain. Most of it is just a normal part of our world, even our own bodies. The key is just knowing that those few dangerous strains exist, and that simple, smart hygiene is your absolute best defense against them. Ultimately, understanding E. coli really shows how we can manage an invisible threat just by having the right knowledge and habits. It kind of makes you wonder, doesn't it? What other unseen challenges are out there that we could tackle just by understanding them a little bit better?